Hello, everybody. Welcome to this edition of my newsletter, video newsletter. Today's topic, I want to spend a little time talking to you about one of the presentations that I give to many of my patients and have done so for many years. And it's a topic that, excuse me, that will lead into a number of different topics as we go along. And it's a good one to, to start off with, and it's called okay is not okay. So, what I mean by that is, most people with spinal problems, whether it be low back, middle back, neck, headache problems, are living at one certain level all the time. And when they come into my office, I try to determine how they've been living and where they are in this scale. Most we'll start off with what I call my three line theory, and the top line is good, and good is, in my eyes, it means everything is working the way it was designed to work. There's no stiffness in the morning, no catches when you get up after sitting too long. You can do a little bit of physical work and not have it bother you. It is good. There is nothing going on with your spine. All right, that's good. On the bottom here, we have bad. This is where I see most people, obviously, when they come into my office. Right, they've had a bad incident and they're really in pain, and here they are. They show up in my office. But one of the first questions I ask is what kind of, what was going on prior to this bad incident happening? And one of the usual replies is, oh, it was okay, certainly nothing like this. Well, I immediately go back to the okay comment and go, okay, define okay to me. Well, I always have a little bit of achiness in my back, or it always bothers me when I sit too long, but it's okay, all right? So we've got this okay line. This is a place that a lot of people are living all the time. It's not bad enough to stop them from working or going to work or doing some of the activities that they want to do. It's basically okay. And they tend to gravitate between okay and bad. So you see them and they get it fixed up to a certain extent, and then to the okay level, and then that's fine, all right? The problem with living on the okay line is that the majority of damage being done to your spine is being done while you are on this level, not this level. This level here, these incidents are really irrelevant. It's what's going on here that's causing the degeneration, it's causing the joint inflammation and swelling, it's causing all of those things to happen as time goes on. It's here the problem is, not here. And therefore you should be gravitating between good and okay. The minute it starts any of those minor symptoms, that's when you need to deal with it. And you should always be trying to live onto that good line. Very few people do that, all right? And that's causing a real problem. This is a dangerous place to be living. It's causing all kinds of problems inside that you're not aware of. It's causing all kinds of disc degeneration and wearing out as time goes on. It's not a great place to be, right? So we'll be spending a lot more time in the next few videos talking about some of these changes that are going on as a result of living on that okay line. We'll be talking about disc problems. We'll be talking about herniations and disc protrusions and pinched nerves and MRIs and stuff like that. So we'll spend a little bit of time explaining why it's not a good thing to be listening or to be living on that okay line. So for the time being, that's something that'll get us started, and we'll carry on the next time. When I see you, we'll have another step in this process. Okay? See you then.